As my teeth were eroding, it was particularly my bottom front teeth, and they were very visible. And I was just really uncomfortable with the way they looked, with the way my smile looked. I could, look in the mirror and see myself how they were kind of wearing away.
So Mary Jean, yeah, I remember when she came in, she had gone to multiple dentists, gone through different treatment plans. Her problem was that her teeth would run down. So when I saw her, I said, Mary Jean, I need to do a thorough workup on you, and then I can tell you. So we did a thorough workup on her, and then I was able to figure out that yes, we can still give her a beautiful smile, we can keep all her teeth, and we can avoid doing braces. And in the end, that's what we did, what we call a traditional full mouth reconstruction.
It was not particularly a hard decision to move forward with all of the crowns, because I knew it was a lifetime fix and that there was no shortcut around it. There couldn't be a little patch that was put on them, that it was extensive work, and I was well aware of that. It was an opportunity, because I had had really small teeth my whole life. It was an opportunity to get something different and to get a smile that I loved.
She got her teeth capped, and in the end, she's really, and even I am really happy with the results we got.
It was a fascinating process to go through that of, my teeth don't look the way they used to look, for sure. I just love them, and they're fantastic. They're normal sized teeth. I knew if I didn't do something that I was probably going to start losing my teeth. So that made it a pretty straightforward decision for me.
Usually when we do this kind of reconstruction, patient is going through multiple crowns, front crowns, fitting them right so that their bite is right. That's more technical, that's my job, but how they want to see themselves, the shape, the color, that's patient's eyes. So when we do it, I would put them in, I would just put them in temporarily. Mary Jean, go home, try them for 1 week, see how you feel and everything. And if they come back that, hey, I need this change, I need that change, yeah, we do it, because in the end, it's their smile. I want them happy. That's the end goal of this treatment.
I'd just really like to thank Dr. Dewan and everyone at the Dental Implant Center. Would highly recommend if anyone is interested in it. I probably waited too long. I wish I had done it sooner, because waiting wasn't going to change the outcome for me. I'm just totally pleased with the work that Dr. Dewan did, and just everything, the staff, and how everything ran.
Before I had the implants done, I was dealing with a very interesting case. The case was that I had bridges put on the lower bottom of both sides of my mouth. And then suddenly one day I was eating, and the bridge had eroded on my right side. And then about 2 weeks later, the bridge had eroded on my left side. I thought that I could just go and get some more bridges put in, but it turned out that it was much worse than that. I couldn't eat on either side, so that impacted my digestive system, in which I couldn't chew my food. So when I went to Dr. Dewan's office, he did an exam and told me what I would need.
Sherry was interesting in that fact that her lower jaw was kind of problematic. So she came in, we had the scans and everything, and we discussed the options, and she wanted to have a fixed bridge.
It wasn't a simple procedure. It was a little bit scary for me. But then he was very knowledgeable and very informative, and he walked me through the whole procedure. And when he walked me through that, I knew that I had to have the procedure done, because I had to have I had to be able to chew properly. So then I had the surgery. I have 4 implants, and they are not removable, not removable at all. They have to be screwed in and out in order for them to check on my gums to do that.
We gave the customized treatment plan, but customized teeth to the patient. So I remember her distinctly, and she's really happy. She's been coming here, and we are able to maintain and clean and that bridge and take x-rays to see if there is any bone loss on implants or not. And so far so good, and I am happy that she's one of those patients among all my patients who's really happy with the treatment, and that's the result we look for.
Center was a great place to be because I'm the type of person that I don't make quick decisions, and therefore the office would sit down with me and they gave me all the information that I needed. They answered all the questions that I had. They walked me through the procedure step by step. So I felt like I was in good hands, and that it was a very rewarding experience if you find yourself in this situation.
Well, I was having some pain and stuff, and realized that maybe it was dental. And so I looked up online to see a place that I might, get just some cleaning and stuff done. And that's when I came in here and did x-rays and all of that. And I found that I did have infection all over.
So Diane is an elderly patient. She came to us with multiple failing teeth. Her main issue was that as her teeth are hurting, she couldn't enjoy her food. Okay, so we sat down, took a CBCT, we looked at everything else, and then I asked Diane, if you are interested in enjoying your food, you basically won't be a good candidate for traditional dentures. So we talked about implant options, and Diane chose to have an implant denture done.
After I came in the first time and found out that I needed work and needed to see a surgeon, I came in, saw Dr. Joan, and he looked over all the x-rays and different things and told me that I needed pretty much to have all of my teeth taken out.
We took our time, we went slowly, we took couple of teeth, placed an implant, took couple of teeth, and in the end we got it done. And Diane is so happy that at least those teeth don't hurt. She has teeth with which she can smile with, can eat her food, even though she's still in temporary, she's still in the healing phase. But I am so happy that even though it took us time, we are able to deliver such a good result.
Since I've had the work done and the teeth removed, my health has improved, and I'm feeling a lot better, and I'm looking forward to the future of having a full mouthful of teeth and being able to eat foods that I have been in the past, being able to chew and smile, be able to have a good smile.
Encontré la oficina de implantes de Colorado en el Facebook cuando yo estaba yo buscando una solución para mí, y encontré esta clínica. Yo vine porque tenía problemas dentales ya, ¿verdad? Con las pocas piezas que tenía, y tenía dolor en las encías. Ya no podía comer, no podía masticar la comida. Tenía algunos dentales míos, pero ya estaban muy dañados.
Cuando llegó Armando, él pensó que solo le faltaba un diente. Cuando le tomamos una radiografía, el doctor le explicó que tenía muchos dientes, pero igual el nivel de su hueso estaba demasiado bajo. Así que el doctor propuso que le quitáramos todos los dientes y que le pusiéramos una dentadura con implantes permanente. Eso sería un proceso más largo, pero que le ayudaría más a largo plazo.
Cuando ellos me propusieron que me tenía que poner implantes, era porque iba a dejar ya de tener dolor, iba ya a poder masticar bien, Y aparte de eso, pues me dieron las facilidades de pago.
Él nos decía que le encantaba la comida, entonces él nos dijo que estaba batallando mucho para comer, pero hasta ahora con sus temporales, porque aún no tiene los permanentes, él está feliz y ha podido comer más comidas que lo que podía antes. Entonces para él ha sido mucho cambio y ha decidido que también los de arriba es importante para poder comer todo bien.
Ya tenía 25 años sufriendo de no poder masticar bien la comida. Un steak ya no lo comía, una manzana ya no lo comía. Y ahora, pues con esto, ¿verdad? Pues estoy feliz porque voy a poder comer todo lo que se me antoja. Desde la primera consulta que yo tuve aquí con ustedes, ¿verdad? Siempre me trataron como debe ser, ¿verdad? Un cliente, o un paciente más bien. Y me dieron todas las atenciones, nunca me han dicho nada fuera de lo normal, me han tratado bien. El doctor Duan, ¿verdad? Siempre, desde un principio, ¿verdad? Cuando yo lo miré, o sea, yo no sé, yo sentí como confianza, me dio confianza y sentí como que él era el hombre, el dentista que me podría él ayudar. Yo estoy fascinado, estoy contento, ¿verdad? Y yo sí, estoy, si en caso dado, ¿verdad? Alguno de mis familias, un amigo o cualquier persona que yo viera en problemas dentales, yo le recomiendo la clínica de Colorado.
Hola, me llamo Gina y vine a Dental Implant Center of Colorado porque tenía tantos problemas con la parte superior de la boca. Bueno, yo crecí en México, entonces obviamente no teníamos dinero, muy pocas veces o casi nunca fui al dentista, entonces empecé a perder dientes. Cuando llegué a este país, estuve como hace 12 o 13 años en otra clínica y me trataron de ayudar, pero honestamente no terminé el tratamiento, así es de que seguía perdiendo dientes al grado de que prácticamente ya no tenía dientes en la parte de arriba. La parte de abajo todavía la vamos a empezar a trabajar, pero toda la parte de arriba estaba prácticamente sin dientes. Estaba usando una prótesis horrorosa. Yo tengo un programa de radio y trabajo para la comunidad. Soy una líder comunitaria y doy muchas presentaciones en público y siempre estoy en eventos y era tan incómodo porque no podía reírme, no podía hablar con tanta seguridad como con la que hablo siempre, porque siempre sentía vergüenza y muchas veces cubría la boca. Estaba casi por darme por vencida y de pronto empecé a buscar ahí en Facebook, me apareció un anuncio, hice mi cita, la recepcionista hablaba español, me encantó eso, me dio mi cita para el día siguiente y vine.
Con Gina, ella cuando llegó estaba muy preocupada por sus dientes de arriba, nos explicó que ella trabajaba en una radio, así que para ella su sonrisa era muy importante. Cuando nosotros propusimos algo para ella, le gustó mucho la idea, entonces decidió hacerlo con nosotros. Tuvo mucha confianza con el doctor Duan. Aunque aún no hemos acabado con el proceso de Gina, Gina está muy contenta y también nosotros estamos muy contentas y esperamos que el resultado final sea lo que ella quiere y que todos salgamos satisfechos.
Hablé con el doctor Duan y él me hizo sentir tan cómoda que realmente creí lo que me estaba diciendo y dije, lo tomo. No lo dudé ni tantito. Me dijo cuánto iba a costar. Ese día afortunadamente traía la mitad del dinero, lo pagué y me quedé porque realmente sentí como esa conexión y me encanta honestamente. El doctor Duan es increíble. Honestamente, hasta mi hija, ¿no? Y mis amigos cercanos me dicen como, wow, es que hasta la mirada te ha cambiado. Ahora sonríes no solamente con la boca, pero también con los ojos, con todo, porque te sientes tan segura de ti misma. Y definitivamente el poder sonreír sin vergüenza, sin tener que ocultar huecos, eso te hace sentir muy segura y eso se refleja no solamente en tu vida personal, pero también en tu ambiente de trabajo, en tu vida social. Es increíble. Es la seguridad que tengo ahora. No la tendría si no hubiera venido con el doctor a ponerme mis dientes.
My name is Aaron, and I had a full mouth reconstruction at Dr. Dewan's office. I'm 64 years old now. When I was 55, I started losing my back teeth, and everything was okay. I just had to kind of adjust my eating. And when I turned 55, I lost, I think what it is my eye tooth. So then I'm very kind of conscientious about my appearance, my smile and stuff because of where I come from. Don't want to wear my heritage in my mouth. So I started just having to, look at people and just let them see the good side of me. And I did that for about 4 years. And then I lost my other eye tooth. And then I really just got to where I couldn't smile. Aaron's a big smiler. I laugh and I smile real big. And my wife started getting concerned about it. And so we started talking about it and felt that I needed to take some action to do something about it.
Aaron, he told me later he was going somewhere else and he saw the board and the clinic and he just walked in and he's been dealing with those bad teeth for so many years. Like basically he was so self-conscious, he didn't want to smile. He said, I don't want to go out much. He was actually thankful of COVID that now everybody is wearing masks and he's not going to show his teeth and can just go around everywhere.
I got on the internet and Dr. Dewan's name was at the top. Anyway, came in feeling very comfortable, sat down with Dr. Dewan, and he's very personable, very humble. I like that as a person and felt very comfortable with it. And he took some 360 x-rays and showed me how actual bad my bones were. And we pretty much that day made a deal.
So we sat down, I talked to him, I said, okay, your teeth are bad and there's a lot of gum disease, you're a lot of missing teeth, and what your expectations are. He told me straight up that he cannot have anything removable. So we went over his scan, we looked at it, and I said, okay, so you got good bone, we could do fixed options for you, and from there it was a go.
I came in a month later, and since then it's been an awesome experience. The first day I had 26 teeth, I think, extracted. Put permanents in, temporaries in that day, and I walked out. And from that day on, I've actually been able to smile pretty big and been my jovial self again. And it's just been a total transformation.
We started the surgery early in the morning, got the surgery done, teeth were taken out, implants placed, and the teeth were placed. And then we saw him day after. He was really happy. Like he said, by fluke I entered here, but doctor, I'm so happy I came and saw you guys, and I'm very happy with my treatment.
Say it. Good boy. Good boy. Yeah, the best decision was to do the full dental implants. And I think the biggest change that I've noticed is in other people's reaction to me. They see me smiling again. I'm my old Aaron again. I can laugh and get a little crazy again, because I was very apprehensive to smile before I started this process, because for one, I had 2 teeth missing that you could see.
As a doctor, as a team leader, I'm really happy with the results we are getting with Aaron. He's motivated, he's really happy, and that's what we really want. And we are undergoing his treatment. We'll be finishing it up shortly, and I'm so happy I can deliver that kind of care for not only Aaron, but so many other of my patients here at the practice.
It's an amazing feeling to have your teeth back, and I think the biggest thing, or one of the biggest things, is I don't have any pain anymore. I have actually had no pain since Dr. Dewan did this. The increased confidence in being able to smile and not being apprehensive about it, and not even having a thought in my mind that I can go to one of my customers and laugh with them and smile with them and joke with them, and it's been a total transformation for me.